want to talk about tobacco, risks of use, and cancer. And again, Andre Reyes from the Community Outreach and Engagement Office at Columbia Cancer Center. So we've got a lot to talk about today. So we're going to learn about tobacco, what it is, the different types of products, because there are tons of different types of products, and there are lots of ways that you can get tobacco into your system. There's the tobacco that you smoke, the smokeless, ones that dissolve, and vaping. We'll learn about what's in tobacco products, what harm tobacco products can do to your body, and where to get help to quit smoking for yourself or for a loved one. So what is tobacco? So it's a plant, right? And it's grown, it's a nice looking plant too. It's grown for its leaves. These leaves are dried and then they are chopped, right? So what's the big deal about leaves that are dried and chopped? Well, tobacco contains nicotine, and this is the ingredient that leads people to addiction. And that's why people who use tobacco find it so hard to quit, because they keep wanting it and wanting it. There are also many other potentially harmful chemicals found in tobacco, and that happens when you burn the tobacco. It changes the chemical composition of the tobacco, and you actually get other products, right? It turns into something else. Tobacco use causes many types of cancer, including cancer of the lung, the larynx, the mouth, esophagus, throat, bladder, kidney, liver, stomach, pancreas, colon, rectum, and so on. People who use smokeless tobacco, also known as snuff or chewing tobacco, have increased risk of cancers of the mouth because it's in there, right? The esophagus, because you're swallowing some of it, and the pancreas. And just some stats, nearly 9 out of 10 cigarette smokers first try smoking before the age or by the age of 18. So people tend to start pretty young. These are tobacco products that you smoke. I'm sure people at one point or another have seen almost all of these. This is actually where you put these contain the tobacco. And then we'll talk about what's in a cigarette, right? So there are approximately 600 ingredients in cigarettes. When burned, the cigarettes create more than 7,000 chemicals. We know for a fact that 69 of these chemicals are known to cause cancer, and so many more of those are toxic, but we haven't been able to prove that they cause cancer, but at least 69 do. Many of these these chemicals are also found in different types of products, but these products have warning labels, right? And cigarettes don't necessarily have a warning label listing all of the chemicals. So just to give you an idea, right? So what's in a cigarette? There's ingredients from paint, ammonia, which is found in toilet cleaners, nicotine, which can be used as an insecticide. There are solvents like hexane and toluene, right? So there's lighter fluid in there. Arsenic, which is a poison. Cadmium is found in batteries. Butane is also found in lighter fluid. There's methane, which is actually found in sewer gas. It's the component of sewer gas. Carbon monoxide, methanol, which is found in rocket fuel. So as you can see, lots of details, but we just want to make sure that people understand the different types of chemicals that are in a common cigarette. And then we'll talk about what smoking does to your body, right? So you've got a list of cancers and a list of chronic diseases. The most well-known cancer that's caused by tobacco is lung cancer. But because you're smoking and you're getting smoke in your mouth and in your sinuses and your larynx and your esophagus, all of those places actually physically touched by the smoke can be susceptible to cancer, but also because you're swallowing these chemicals, right, in your saliva when you smoke. So you can get cancer in your stomach and in your liver, in your kidneys, in your pancreas, colorectal cancer, and more. But smoking can also lead to chronic diseases, like you can get strokes or blindness or cataracts. It can affect your vision, heart disease, be more susceptible to pneumonia. You can get vascular disease, which is disease in your blood, in your veins, right? In your diabetes. It can affect your unborn child. It can lead to rheumatoid arthritis, lowered immune function, and more. And just not the prettiest picture, but this is what can happen to your lungs. So the pink lungs are the lungs of a non-smoker, and the black lungs are the lungs of someone who has smoked, and quite heavily at that. So why do they turn black? Because every time you inhale tobacco smoke, it deposits tar in your lungs. Tar is a component in cigarette. It's a very sticky, greasy type substance. Over time, enough tar deposits build up in the bronchioles, and then it gets distributed through the entire lungs, right? So, many smokers are at increased risk for smoker's cough, because your bronchioles are clogged with this black stuff and with the ash and the soot from the tobacco smoke or the cigarettes or the hookah or whatever you're smoking. You get less oxygen to your blood, to your system, and to your brain, because your lungs are clogged on a very kind of micro level. And so this clogging of the lungs, and this mucus that's always there can lead to smoker's cough. It can lead to bronchitis. You can get infections a lot easier in your lungs as well. Secondhand smoke is also not safe, right? So what's secondhand smoke? It's when someone else is smoking and you're inhaling it. And you can get lots of different health problems. So kids can get wheezing and coughing and asthma attacks and ear infections. Adults, some of the more common conditions for secondhand smoke are heart disease, stroke, and lung cancer as well. Smoking during pregnancy is unsafe. It causes babies to be born smaller than they should be and too early. They can have birth defects, and they can be born with damage in the brain and in the development of the lungs as well. So just for you to know that nicotine is a health danger for pregnant women, and that's been demonstrated over and over in studies and in real life. Hookah has become really popular uptown Manhattan in the last couple of years. It's found in a lot of bars and restaurants. And it's important for people to know that it's not safer than cigarette smoking. Just because the smoke goes into a water bowl, it doesn't mean it gets filtered, right? So it's no less toxic in a hookah pipe, the tobacco, than in a cigarette. And hookah smokers may actually inhale more tobacco smoke than cigarette smokers do. Because if you think about it, cigarette lasts 3 minutes, 2 minutes, depending, right? But when people sit and smoke hookah at a party, they're there for a long time, sometimes up to 40 minutes till it's all done. So imagine smoking cigarettes nonstop for 40 minutes. That's the same effect that you get in your body with the hookah. So just to know, sometimes when people buy hookahs at restaurants, doesn't mean it's any safer. And this is, fun facts here, right? Smoking a hookah is equivalent to smoking 100 cigarettes. Why? Because a session of hookah lasts about 45 minutes to an hour. And in that time, you're breathing in about as much smoke as a cigarette smoker would from 100 or more cigarettes. So I would say it's pretty hard to find someone who would be willing, even a heavy smoker, to smoke 100 cigarettes, right, in an hour. But you're getting that with hookah. And it's also addictive. It can cause a lot of the same different types of diseases and infections. It can decrease fertility in men and women. And then a lot of times people share the mouthpiece of the pipe. I think it's happening less now, but in the beginning, people would share the mouthpiece, right? And so aside from getting what everyone knows, something like COVID or a cold, people were passing on or are passing on when they share the mouthpiece, herpes, hepatitis, and tuberculosis. So e-cigarettes, like to talk about that. A lot of people try to use e-cigarettes when they're trying to quit, which is not the best idea when they're trying to quit regular cigarettes. Some people think, oh, it's cleaner, but it's just a different type of danger. These are the different types of e-cigarettes that one can find, and then the little bottles of oils. It's good for people who are parents to also know what e-cigarettes can look like, because sometimes they even look like just a flash drive. And your teens, if you have teens, could potentially be hiding these products in their bag, and parents aren't thinking of looking at every single item, and it certainly doesn't look like something that you smoke sometimes. So a little bit more on the e-cigarette vapor. So it's not harmless water vapor. It contains nicotine, which can lead to addiction. It contains ultra-fine particles, and these particles can get deeper into the lungs, right? So if they're in a vapor, they're going to reach more parts of the bronchium. It has cancer-causing chemicals and heavy metals such as nickel, tin, and lead, which you don't want in your system. You want to be inhaling them. And the flavoring is also a chemical that leads to serious lung disease. I put a little image of a popcorn there because it's called popcorn lung. And it's just basically your lung tissue kind of breaking apart, and people are left with sometimes on oxygen tanks for the rest of their lives after they have popcorn lung, because they're just not able to breathe because their lung tissue is damaged. So the risks of vaping, number one, are nicotine addiction. You're going to keep wanting it, right? You can have irritation in your mouth and throat and in your lungs. That'll cause coughing and wheezing. If you have asthma, it can make it worse. You'll have chest pain. It'll raise your blood pressure and your heart rate. And some people actually get upset stomach and nausea from vaping. E-cigarettes can harm children because it can affect your developing brain. So when you see a young person doing it, and especially if they are under age 25, their brain is still developing, and the vaping will affect the structure of their brains. And it could also lead into increased risk for future addiction. So it is unsafe for all people. There are smokeless tobacco products as well, and we don't want to leave this out. This is important. Some people use the chewing tobacco. Sometimes they use the snuff, which goes up into their nose. The problem is that For here, the nicotine and the chemicals are absorbed through the lining of the mouth or the lips, and people are at increased risk of mouth cancers. And there are also a bunch of these other things, right? Like the orbs, the pellets, the sticks, the strips. These are just all other ways to get nicotine into your system, and not one of them is safe. Just some information on the smokeless tobacco products. These are really long names if you're looking at the screen. The one that you'll probably recognize is nicotine because we've already talked about it, but there are all sorts of other particles, toxic chemicals, fluids that are soaked into the snuff to make it more addictive and more palatable, but it's also just still dangerous. Another fun fact, smokeless tobacco contains over 3,000 chemicals and parts, also not good for you. Okay, and what are the risks of the smokeless tobacco? Well, of course, oral cancer, but of your cheek, gums, lips, tongue, mouth, dental problems, pancreatic cancer, and esophageal cancer. Holding smokeless tobacco in your mouth for 30 minutes can give you as much nicotine as smoking 3 cigarettes. So if you think about it, these are actually even more powerful. There's more damage being caused by them than regular cigarettes. The benefits of quitting: if you quit right now, after 20 minutes, your heart rate and blood pressure drop. After 12 hours, your monoxide levels, which is carbon monoxide, is super dangerous and poisonous for your body, they're back to normal. Over the first year, your taste and smell return. All of the fine things in food, you'll be able to taste better. At 1 to 9 months, if you're coughing already, your coughing and shortness of breath will decrease because your lungs are functioning better. So at 2 to 5 years, your stroke risk drops. And so you're a lot less likely to have a stroke. And then within 10 years, your risk of dying from lung cancer is half than what it would be from an active smoker. And so there's lots of different ways to quit. You could join a tobacco treatment program. I happen to be a tobacco cessation specialist. These treatment options, they give you choices. And when you talk to a tobacco counselor, they create a program that works for you. Some people, when I talk to, they're like, oh, I can't do that. I'm like, all right, well, you know what? Let's find something that you can do. What are you willing to do? What can you live with? Let's try to get you to smoke less and less, but what would work best? And so the programs give you ongoing support and motivation. They'll answer your questions and they'll help you to avoid starting again. This is my contact info. So the nicotine replacement therapy is really helpful. And what that has is just a touch of nicotine, so that when you want to go smoke or use whatever product you're using, you use one of those products to just give you a touch of the nicotine, but it doesn't have all of the other chemicals that are harmful. It's basically all an effort because you have a certain level of nicotine that you're used to in your system as a smoker, right? So you start to reduce and reduce and reduce. You're not getting as much as you would from, let's say, if you're a cigarette smoker. So when people try to quit, it's always recommended to use 2 different products. So you use 2 products. So I, as a tobacco treatment counselor, try to get people on the patch, right? Because that's not intrusive. It's just a sticker on your body. And then I tell them, try to use the lozenges or the gum. So you want to use 2 different products to try to quit. And then I even ask people if they're willing to cut the tips of the cigarettes off. And then every week or 2, cut a little bit more and more so that when they do smoke, they're smoking less, right? And the patch takes a lot of the desire to smoke away for most people. Some people it doesn't work, or maybe they're not using right or whatever. It just kind of doesn't work for them. But the patch can be really helpful. But you want to keep your mouth busy too, because so much of it is habit. Exactly. And that motion of this, they do have, it looks like a little fake cigarette or a whistle, and it is part of nicotine replacement therapy. So it's not a vape, but it gives you the sensation that you're putting something to your mouth and inhaling. And it helps you with that habit, but it's the same ingredients that are in the patch and the same that's in the little lozenges. So you chew the gum when you feel like it keeps your mouth busy when you feel like you want to smoke.